South Africa's healthcare system is not dissimilar to most African countries, and I will specifically reference Nigeria. And I think we would all agree that we live in countries, or we live in a continent where healthcare has really become a luxury good. Quality healthcare has really been reserved for the haves. And if you have not, you either die or you have complications, or you pretty much have to give up your life savings to access healthcare. And these are the challenges that I was trying to address in my country, where we've got 85 to 86% of the population that's uninsured, meaning that it's a population that therefore cannot access the private healthcare sector and is reliant on a public healthcare sector. The markets that I was particularly looking at that is particularly vulnerable to this phenomenon are people that are employed. So the employed, the uninsured, because if you're employed and you're uninsured and you get sick in South Africa, and I'm sure in Nigeria as well, you've got one of three options. The first is to access care in the public sector. And as we can all agree, this sector is characterized by long queues, where in my country people have to get to the clinic no later than 4 a.m., some 5 a.m. at the latest, and get serviced hours later if ever. Now, for somebody who's employed, this means a loss of days' wages. This means a loss of employment. And couple that with a country that's got a high unemployment rate. In my country, we've got an unemployment rate that's 25, 30, 40%, depending on which source you choose to quote. What then this results in, it results in people choosing to not access healthcare because it is just too expensive. Because although the public sector is free, losing your day's wages is not free. The second option is to access the private sector that is, as Dr. Farouk said, seen as efficient, seen as having good outcomes. But once again, the outcomes are seen as, from a customer point of view, not necessarily what we would want to see from a private, from a healthcare or from a medical point of view. This is expensive. This is not only expensive because they have to pay a lot of money up front, but it's expensive because it's unpredictable. People don't know what the whole healthcare intervention is going to cost them. It's only the cost of a consultation that's known. People don't know what the medication coupled with that is going to cost, what investigations they're going to need, and what that's going to cost. And for somebody who's on a tight budget, somebody with not much disposable income, it's too unpredictable and therefore not even an option after all. And then the third option, which people choose to choose in my country, is to not seek healthcare. So defer healthcare, hope for the best. But unfortunately, the best that most people hope for turns out being complications, ends up being premature death. And that is what I was addressing. And this is what we typically call the customer journey. For us to have people-centered healthcare, we need to put ourselves in the shoes of our customers or our patients to understand what are the barriers to access, because if we don't address that, we do too much of a top-down initiative where we take solutions that have worked elsewhere and we try and panel beat them to our patients or to our consumers, which doesn't work. And with that, Quali Health was birthed. It was birthed on the 1st of May 2016. I opened the first facility in an informal township or informal settlement called Diepsloot in South Africa. Diepsloot is a population of about 800,000 people. It's got 2 public health clinics. And what's even alarming about these public clinics is that they don't even have enough capacity. They've got a capacity to see about 80 to maximum 100 patients a day. They open at 8 o'clock in the morning. They close at 3 p.m. and they don't open on weekends. What's even more alarming about Diepsloot is that it's 40 kilometers away from the next referral hospital. So somebody who gets sick at 3 or 4 p.m. Doesn't have anywhere to go. That person has to either knock on a neighbor's door, try and get transportation to go to the hospital, has to pay 3,000 Rand, which is about $300 to go if they want to call an ambulance. And therefore, the mortality rates in these communities is alarming, and that's why I felt the need to open the first facility there. So Quali Health was conceptualized basically on three main pillars. The first one is affordability. And affordability we looked at in a broader context. Affordability is not just the cost that you pay when you come and consult. Affordability has to be all-encompassing. What do I mean by that? Affordability we express in terms of us being a single entry price, meaning that as a customer who's a lay person who doesn't know what you have, who doesn't know what intervention you're going to need, you need to be assured that the price that you pay is a price that you're paying for a health outcome and not just an episode. And so therefore we've adopted the single entry price, and that single entry price assures that the patient will get medication with a consultation. If they need an ultrasound and they're pregnant, they get that included. If they need any procedures or any blood tests that we need to generate a diagnosis, it's all included. So therefore that gives that patient peace of mind. But we went further. The healthcare sector, I think, is the only sector at the moment that puts all the risk on the patient or the consumer. So we know you consult. If you've paid for a consultation and you don't get better, the trend is you go back and you pay again. As medical practitioners, we don't take that accountability, and that's what we wanted to change. So we've got a free follow-up for 10 days, which means if you don't get better, you come back and we'll ensure that you get better, which is actually quite a nice incentive for our practitioners, because we need to make sure that we treat conditions correctly from the word go. And if we don't, we find solutions or we find partners that can help us manage those conditions better. And follow-ups are a gift that keeps on giving, because now we know what we can get better at. Now we know what our patients need. Now we know what our patients don't respond to, because they actually have, we enable them to come back. We then looked at, I mentioned that Deep Sloot, which is our first facility, was 40 kilometers away from the referral hospital. We looked at affordability also in terms of how do we enable this patient to get to the next level of care. Giving them a referral letter and waiving doesn't help, because often they don't go. And we found that out because we then developed this thing of calling all our patients that came to consult the following day to find out how they're doing, because SMSs weren't giving us that feedback to say, you know, this is what's happening. We found that an overwhelming majority of the patients that we referred were actually not getting to the hospital because it was just too difficult. And so we've got a shuttle. We've got two modes of transportation. We enable the patient to go at that single entry price. So we've got a shuttle that will either fetch a patient from home, because we realize that that's a barrier. People are walking. If somebody's feeling ill and not able to come to the clinic, we'll basically send a shuttle out to get them. But our emergencies, we've partnered with an emergency provider. You'll see some slides later. And this emergency provider, where traditionally people would have paid 3,000 Rand or $300 to get to the hospital in an emergency situation, it's included in the 280, and we give that peace of mind and therefore that access. The second pillar, which was very important as well, was convenience. Because you can be affordable, but if you don't make it convenient, you're just a public clinic that charges a fee. And so convenience was very, very important. And there's many ways in which we express our convenience. Firstly, it's opening hours. Something as simple as being open for long enough. So we open 12 hours a day, every single day. In fact, one of our facilities, we've got 4 facilities now in similar communities in Johannesburg. One of our facilities opens 14 hours. So that's one of the ways that we become convenient. But the second most important one is, how do you ensure that as these people come in, that they don't get stuck in queues? And that's where technology comes in. Unfortunately, I missed the session in the morning. Technology is a powerful enabler when used correctly. And our technology allows us to process our patients seamlessly. So from the time somebody registers as a patient to the time they get their medication, we target a time of 20 to 30 minutes. And in that time, we haven't cut down on the time that people spend face-to-face with a practitioner. So globally, the time that people spend face-to-face with a practitioner and the time that it takes to generate a diagnosis is 5 to 8 minutes. And you can time yourself next time you go and consult. You can cut out all the talk about how the kid's doing, how's the weather, how politics. Just the time that a practitioner needs to generate a diagnosis is 5 to 8 minutes. We haven't cut down on that. What we have cut down on is elements that don't add value to our patient or to our customer, and that is the registration, collection, paying, and we've tried to make that as seamless as possible, and our technology has allowed us to do that, and basically taking all the admin away that isn't really adding value. And secondly, what allows us to process our patients so efficiently is our facility design. And we adopted a model that most Indian hospitals use. It's called the MOVE model, and some people, a lot of people in this room might be familiar with it, which is, sorry, can we move to the next slide? Which is just making sure that the facility is set up in such a way that there's constant movement, people don't get stuck, there's no bottlenecks, and if there are bottlenecks, you can quickly correct for those bottlenecks. It's set up like an emergency because what you want to drive is that high energy. There's a slowing down that happens when somebody consults, when there's a desk and a chair, and we wanted to make sure that we remove that, and we stick to our processing times where possible. So if somebody spends longer than 20 to 30 minutes, it's because they need to. It's either they're on an IV, or they're getting an ultrasound, or they're getting a procedure. Basically, if you are spending longer than what we want you to spend or would like you to spend, it's because you need to spend it. We're not actually taking that value from you. And it's really just about bringing dignity, respect, compassion to people that often get treated without. And I think it's a global phenomenon that when people don't have money, or when we perceive people to not have money, we tend not to respect their time. And that's really one thing that we wanted to do away with. And the third pillar, which is perhaps the most important, is quality. Because you can be affordable, you can be convenient, but if you don't have the right quality, you're still actually not providing the access to what you should be providing. And quality is very important, and quality is expressed in the softer items. Before I get into the medical impact and how we actually measure our outcomes, quality in just how facilities look, in just the aesthetics, to have environments where people actually feel that they're being serviced in a place that affords them that dignity, respect, and compassion, and also making sure that you've got equipment that will ensure that you give them the right quality. And that's the first thing, and that, like I said, is challenging, because the healthcare sector is not really geared to provide healthcare to low income. It's really geared for high margin organizations, and we've had to find innovative ways to get the right equipment at the right price so that we don't necessarily have to transfer that cost to our patients. That is our ambulance provider. And just before I get into the health outcomes, one of the things that we have learned, and that most of you would agree with, is that what's very, very important in terms of health outcomes is collaboration. There's a global move towards value-based healthcare, which says you need to know what you're good at, you need to know what you can be the best at, and you need to basically collaborate with other partners that can carry those elements from you. And that's something that we really wanted to do. And our first collaboration was with this ambulance provider. They're the ones that enable us to be able to service the patients at the single entry price and still be able to give them emergency care, which doesn't only end there, it also comes into them assisting our staff and upskilling our staff in emergency care and how to respond in emergencies, and the communities as well, because we're not only facility-based, but we try and involve the broader community in terms of CPR and teaching them how to respond timelessly in the event of them facing situations like that. This is our call center. So we've got a call center that calls every single patient the day after consultation, which is an important touch point for us. Our patients, we find, that are not ready to really move to a point where they can have healthcare in their hands. They're still intimidated by it. We are moving that way, and we're paving the way to do that. At the moment, it is still not necessarily face-to-face, but it's still a human contact, and we use community healthcare workers to do the calls and to follow up on patients to make sure if they're taking their medication as they should. You can move to the next slide. And this, interestingly, Dr. Farouk, we are on the brink of partnering with Pathfinder with regards to reproductive health and maternal health, because one of the disease entities that we have chosen to focus on is maternal health, but to not just look at it when a woman is pregnant, but to follow that journey from when she becomes sexually active to when she becomes pregnant, basically trying to foster early testing of pregnancy to make sure that we prevent a lot of the complications that we're seeing in pregnancy, and then to journey with that woman to the point where she delivers. We can't deliver, we don't have a maternity license, but we are basically having talks with partners, and in some, those are established already, where patients can go and deliver. And obviously the journey doesn't end there. Next slide. At some point she gives birth to a baby who grows up, and that's where we're also then partnering with daycare facilities to facilitate that movement into seamless movement into early child development. This is something that we typically do. We go into the communities, we test for blood sugar, and we test for hypertension, because we realize that these are disease entities, non-communicable diseases, have been neglected. As great as the move and the research and all the progress has been done with HIV, first of all, we can learn from it because a lot of strides have been made. We can learn from it in terms of how to measure outcomes, but it has come at the expense of neglecting non-communicable diseases, which expresses itself when a diabetic patient says, I actually wish I had HIV because there's so much access, or there's better access to HIV treatment than there is with diabetes, and we're trying to solve that. And once again, it's not just solving it at a facility level, it's still just going out there and giving people access to screening. And once we screen them, we move them into the facilities, and once we've moved them into the facilities, we've got programs on how we can make sure that we prevent end organ damage through adherence groups and through partnerships, once again, with facilities where we can refer the patients to once we pick up those complications. And so at the heart of who we are is customer-centric healthcare. At the heart of who we are is solving problems that will make sense to the patient, but obviously not losing sight of the medical intricacies and the healthcare intricacies, and measuring outcomes in the way that we know matters and in the way that we know we need to do it to make an impact. And in a nutshell, what we're trying to do is just basically making sure that healthcare sees us to remain a luxury good, and healthcare is not only limited to the haves, but is democratized and available to every single person.